At the University of Minnesota School of Nursing, we've transitioned to new ways of learning, have uncertainties about how we will meet clinical hours, and have missed important milestones like graduation ceremonies. As people, it's normal to get lost in worry and ruminate about things out of our control. Although understandable, it's not helpful. FACE COVID is an acronym that uses principles of acceptance and commitment therapy. The Psychiatric Mental Health Doctor of Nursing Practice students have been using these principles to help with uncertainty, and we invite for you to join.
COVID has changed our world in many ways that we can't control. One way that I face COVID is by taking control of what I can. I can control how much time I spend studying and that I take some exercise even though my gym is closed.
When things feel challenging or overwhelming, it's a good time to actively acknowledge your own thoughts and feelings. Sit comfortably and label your emotions in your head or even out loud. Being a neutral observer and noting your emotions gives you power over them. It won't make them go away, but it will help you to accept them.
When I feel my anxiety and worrying thoughts start to show up in my body, I focus on coming back to my physical body by lighting some candles, taking a warm bath with Epsom salts, and listening to a guided meditation on the Headspace app. I find this routine to be especially helpful as it provides calming cues through multiple sensory inputs, such as the smell and vision of the burning candle, warmth through the water on my body, and the sound of the meditation.
This is one way I face COVID. I try to fully engage in the present. Whether I'm studying for school, working at the hospital, taking care of my kids, or even cooking dinner, I try to focus on the here and now. In these uncertain times, engaging in the activity at hand helps me to stay mindful and calm.
I've been focusing on committed action. So when I study, I try to light a study candle, and I know when that candle is lit, it's my time to study. I've also been scheduling daily walks with my dogs outside, which is good for them and me.
During this uncertain time, I cannot stop the feelings that occur, but being mindful of my feelings and struggles and responding with compassion, kindness, and support in times of difficulty will provide strength and assist in coping.
In stressful times, it's easy to just regress and react in the moment and not live our values. It's important to think about what you want to stand for in the face of crisis. One way that I recall my values each day is to take 5 minutes to meditate on the values that I stand for. I also keep in touch with those that have similar values as me.
A way I connect with my values is by reading books. Recently, I read a book that incorporated cultural themes, which I found genuine, relatable, and inspiring. This helped me to remember what I truly care about in life. Things like family, relationships, art, education, and having compassion for myself and others. Our minds are powerful, and reading a book can remind us of our values while taking us on an adventure. This has been helpful for me, and hopefully it could help you too.
It is important to go to reputable sites for reliable information, such as the World Health Organization, the CDC, and your state's health departments. Additionally, it is important to identify resources on a personal level. Who can you turn to for help? For mental health support? Create a list of emergency phone numbers you can call in times of crisis. These numbers may include family, friends, neighbors, emergency hotlines, and your healthcare professionals. Reach out to social networks and offer support if you're able. You can be a resource to other people, just as they can be for you.
D for distance. Keep your distance, but do not disconnect.
Our 2020 cohort graduation has been canceled, but we are making do using virtual reality. We are breaking ground.
Maintaining social connections while social distancing is important. It's the only way that we can stop the virus.
Do your part. Your community needs you.
As problems from COVID-19 pile up in the world around you and emotional storms rage in the world within you, come back to the steps of Face COVID. One last thing. COVID has been traumatic for many in our country and across the globe. And when this crisis is over, many will experience grief and loss as well as post-trauma responses. Some people may experience symptoms of post-traumatic stress disorder, such as intrusive and fearful memories, nightmares, sadness, and ongoing fear. Should this happen to you, please reach out to a mental health provider because there is help for this. You are not alone.
We can face COVID together.